My son Sasha.
My 7-year-old daughter KRISTA. My son Ram.
My 13-year-old daughter Sarah
is a patient of More BALABAN.
My name is More BALABAN. I'm a licensed acupuncturist, a board-certified herbalist, and also an NAET practitioner.
So my son Sasha, he is 4 years old. When he was about 1 year old, we started noticing eczema. He was extremely uncomfortable days and night. We found out that he's allergic to several products. I went to More and she started the NAET treatment. After the treatment, the patches are gone. He is totally free of eczema. He's back to his regular diet, and so far so good.
I was looking for something to add to my practice. I was seeing a tremendous increase in people who suffer from seasonal allergies, food sensitivities, and autoimmune diseases, all have in common one thing: an immune system that is confused, is overactive, overreactive, overstimulated. And the answer for that is NAET.
It really has been life-changing meeting More. When my daughter Sarah was 5 years old, she had just constant fatigue off and on. She would miss school. We started the NAET. Sarah started to feel much better.
My name is Fatina Rogazic. I'm pretty much finished with NAET. I had chronic fatigue for about 9 years. I was carrying an EpiPen. I was taking allergy medicine every morning. I was missing a lot of school. More really did heal me. I'm able to go through my days without any allergy medicine. I just have a bunch of energy. I recommend NAET and More's approach to everyone.
NAET stands for NAMBUDRIPAD'S Allergy Elimination Technique. It was invented more than 30 years ago by Dr. Devi NAMBUDRIPAD in California. NAET safely, naturally helps eliminate allergies and rebalance the immune system, reprogram it to understand that these things that we're reacting to are actually things that are safe for us.
My son Ram, when he was 18 months old, he was diagnosed with failure to thrive. He wasn't feeding himself on his own. He was being fed through his stomach. More tested him for different allergens. His allergens, through the blood work we found, were very, very high. I think they were either a 4 or a 5. We started treatment. A lot of his symptoms started to go away. He was just thriving. He was just becoming a regular boy. Eventually, his blood work showed 0. Right now he's 7 years old, he's thriving, he's doing amazing. It's been a wonderful, wonderful experience.
I've been to multiple NAET practitioners, and More definitely is the one that has the most effective approach.
I perform something called kinesiology. It's very accurate, and in many cases it's exactly what I see in the blood work. I have the patient lift up their right arm usually, or the strong arm, and I try to push it down. I'm going to put an item in the left hand of the patient. I'm going to have her try to resist me. The patient's muscle remains strong, which means she does not have any sensitivity to this item. Let's test another item. I'm going to have the patient rub their hand to clear the previous item. And I'm going to test them for something else. This time, the muscle is weak, which means temporarily the immune system gets overwhelmed by the item it's holding. Hence, the body becomes weaker and the muscle weakens temporarily. Assuming that I'm treating her for this item today, we're going to place this vial in her hand and she's going to lie down on her stomach. At this point, I'm going to have the patient take a deep breath in, and I'm going to press certain pressure points on her back. I'm going to have her exhale and press the same points again. Now I'm going to have her breathe fast and keep putting the same pressure on these points. Now she's going to return to her normal breathing, and I'm going to keep stimulating certain acupuncture points and nerve endings on her back. This sends a signal to the immune system and tells it that the item she's holding in her hand is now something that she's not supposed to be reacting to. Now I'm going to test the patient again for the same item. The muscle becomes stronger. I'm going to have the patient lie down for 20 minutes, and acupuncture treatment will assure us that she's in the homeostasis state, which means she's the most balanced she can be at. After 25 hours, the patient comes back and we retest her for the item. At this point, I decide whether it's safe for her to start eating or consuming the item she was treated for. Sometimes we start in a small dosage. If the allergy is very strong or severe, depending on what we see in the blood work, the treatment is different. Usually does not take just one time, and it's a little bit more complex. But the end result is the same. The patient is free of the allergy and can start consuming or coming in contact with the item they were allergic to.
My 7-year-old daughter, KRISTA, is a patient of more. The typical year for KRISTA around the age of 5 was 5 to 6 rounds of antibiotics and 5 to 6 rounds of pneumonias. She was on a daily inhaler. She had a rescue inhaler. She was on constant nebulizing treatments. I even had to go for compression therapy training, and we've also had an oscillator. Since our first appointment, KRISTA has seen a drastic change. Her pulmonologist is astonished by the drastic improvement. She has a lot more energy. We haven't even taken the nebulizer out of the box in the last year.
We can promise you that tomorrow morning you're going to wake up symptoms-free.
I'm so grateful to have met More.
She saved my son.
I wouldn't be in college today if it weren't for her.
We're so grateful for More.
More is an incredible person.
She will find solutions to practically everything.
She has changed our family's life, and Sarah continues to heal, and I believe she will be better than she ever was.